Feeding. Continue to breastfeed or offer formula until your baby is 1 year old. Your baby should be eating solid food meals now as well. Babies at this age take in about 750 to 900 calories per day, and 400 to 500 of these calories should be coming from breast milk or formula. So that's about 24 ounces a day. By 12 months old, babies have weaned their breast milk or formula intake down to 16 ounces per day. At that 12-month-old time, your baby will be switching from formula to cow's milk, although it is fine to keep breastfeeding if you choose to. Start teaching your baby to drink liquids from a cup. Sipper cup or straw cup are okay. Offer water in between breastfeedings or formula feedings. Juice is not recommended. He should be eating 3 meals a day by now: breakfast, lunch, and dinner. Offer formula or breast milk with the meals, as well as between the meals as the mid-morning snack and the mid-afternoon snack. After 1 year old, we'll start switching these snacks over to solid food instead of milk. Your baby is slowly transitioning from eating pureed baby foods to eating small, soft pieces of finger foods. Each baby is different and able to handle these finger foods at slightly different ages. Introduce these new foods carefully with close supervision. If he is still more comfortable eating pureed foods, offer him stage 2 to 3 baby foods, or if you're making it yourself, the texture should be a little more coarse and require more chewing. He can also try eating soft foods like mashed potatoes, yogurt, and cottage cheese. For finger foods, you might offer soft, well-cooked vegetables or ripe fruits cut into 1/4 to 1/2 inch sizes. Grated cheese, low-sugar cereals like Cheerios, well-cooked small pastas, finely chopped tender meats are some other examples. When trying new foods, it may take your baby 10 or even 15 times before they will commit to eating this new food. It's normal for a child to spit the food out. That does not mean that they don't like it. Tip: for meal times, eat together at the dining table. This is a good habit to start now and may also be helpful when introducing new foods. Your baby sees you as his role model and will probably want to eat what you're eating. Iron is an important part of your baby's diet. At this age, the iron stores that your baby got from you are gone now, and he needs to get all of his iron from his diet. Iron-fortified cereals, meats, and beans are good sources of iron. Eating iron-rich foods will help his body have a healthy amount of red blood cells, which are needed to prevent health problems such as anemia. Iron deficiency anemia can also cause behavioral and learning problems during his school-age years. In order to reduce your child's chance of developing a peanut allergy, the American Academy of Pediatrics now recommends introducing peanut-containing foods in children less than 1 year old. Remember that peanuts and peanut butter are considered choking hazards. In order to safely introduce peanuts, you can dissolve 1 teaspoon of peanut butter or 1/2 teaspoon of peanut butter powder into your child's oatmeal or other food. Important: if your child is at high risk for developing a peanut allergy, please contact your pediatrician before introducing peanuts. Your child is considered high risk if she has any of the following: severe eczema, egg allergy, or a family member with a serious peanut allergy. Continue to avoid honey until after 1 year old. Avoid choking hazards, which includes whole hot dogs, nuts, chunks of meat or cheese, peanut butter, whole grapes, hard or sticky candy, gum, popcorn, bagels, uncooked peas, celery, carrots, or other raw vegetables. You might notice that your baby's appetite has decreased at this age. This is because his growth rate is slowing. To add to your challenge, he's got opinions now, and he's more distractible too. Offer your baby the proper meals and formula or breast milk, but let your baby tell you when he is full and wants to stop eating. Never force or trick a child into eating something, as this will lead to feeding problems in the future. I want to introduce you to a feeding philosophy taught by Ellen Satter, author of many children's feeding books, including Child of Mine and How to Get Your Child to Eat. She states that we can all raise children to eat well and not be picky eaters if we follow the division of responsibility in feeding. She presents to us the golden rule for parenting with food. Parents are responsible for what is presented to eat and the manner in which it is presented. Children are responsible for how much and even whether they eat. Parents, this means that you are in charge, up to a limit. As a parent, you'll be deciding what you will be offering your baby for each meal. You'll decide when the meals and snacks occur. You'll decide what age-appropriate form of food to give him, and even where he sits for each meal. Your job ends there, and your child's job begins. Your child's job is to decide what he eats of the healthy choices you've offered and how much he wants to eat. This means that in one meal, he might decide to eat only one type of food that is offered and skip all of the rest. It might even mean that he might eat almost nothing for that meal. It's okay. A quote from her book: "When you try to overrule a child's natural eating cues, his eating ends up getting worse, not better. Children who are forced, cajoled, enticed, or even tricked to eat end up revolted by food and prone to avoid eating if they get a chance." As well, if we force a child to eat, we are also teaching that child to ignore when he feels full. This child might then grow up habitually overeating and risk becoming overweight. I don't want to put too much pressure on you, but good eating habits start now. Let's see what we can do to start your baby off on the right foot.